I'm very glad to introduce our speaker, Milton Friedman, as a friend. Milton, the floor is yours.
Thank you, Bill. I'm going to talk about the economics of medical care. This is an area in which, as we all know, there has been a trend toward ever greater government involvement. Chairman Keating referred essentially to that trend in his comments. One step in this area inevitably leads to another. We have had an expansion of government involvement in the spending of money. Medicare, Medicaid funds, expenditures by the Department of Health, Education, and Welfare for other medical purposes have been growing by leaps and bounds. They have gone from a very tiny portion of the total national expenditures on medical care to a substantial portion. The spending for the provision of medical care inevitably leads to control over the fees that are charged for medical care. And it should. If government is going to spend money, it ought to be concerned with what it pays for what it gets. Control over fees inevitably leads to control over the practices that are followed, over the behavior of the medical personnel. And if this trend continues, it inevitably leads to completely socialized medicine. I believe that this trend, including many of the steps that have already been taken, is very much against the interests of patients, of physicians, and of other healthcare personnel. And in the brief time I have available today, I want to explain why I believe the trend is so much against their interests, why it has occurred, and what, if anything, can be done about it. The trend toward increasing government involvement in healthcare is not an isolated phenomenon. It is not restricted to healthcare. It is part of a general trend in our society toward replacing voluntary free market arrangements by government control and regulation. It is a trend that is happening all over. It has happened in one industry after another. There is nothing special in this respect about the move to replacing private voluntary medical arrangements with compulsory governmental arrangements. This movement in the medical care field is not special in another sense. In industry after industry, producers who protest most strongly their belief in free markets have fostered and helped produce government takeover, government regulation, government control. The oldest case of this, the historical case, was in the railroad industry, where the railroad entrepreneurs helped to foster upon us the Interstate Commerce Commission and all that followed. The same thing has been true in every other area. Most recently, the steel industry, which talks so loudly of its belief in free enterprise, has been strongly in favor of government restrictions on imports, in favor of tariffs and the like. In medicine, the same process has been at work. Indeed, I would say that it is particularly true in medicine. A large part of the pressure for socialized medicine in the United States, in my opinion, and I may say this is not merely opinion, it is based on a considerable examination of the evidence, a large part of the pressure has derived from the policies which have been followed over the decades by the American Medical Association. Policies which were adopted in the name of improving medical care. Policies which I have no doubt that the leaders of medicine regarded as desirable for improving medical care. But policies which have in practice had the effect of restricting entry into medicine, holding down both the quantity and the quality of medical care, and inhibiting the most efficient modes of providing and distributing medical care. There has been great progress in the provision of medical care in the United States. It has been a great achievement, but it's been an achievement despite many of the best efforts of the American Medical Association, not because of it. This is a particularly appropriate place to illustrate my point, because the Mayo Clinic is a shining example of how medical care might have developed in the United States if it had not been for the power of organized medicine. The Mayo Clinic started, as you all know, in the late part of the 19th century or the early part of the 20th century. The exact dating is a question of dispute. But the important point is that it started before 1910. 1910 was a year in which there appeared the famous Flexner Report, Abraham Flexner's report on American medical schools, which provided the basis for an enormous expansion in the power and the control which organized medicine was able to exercise over medical education and over medical practice. That power was used effectively in the 1920s and the 1930s and later to hamper at every turn the kind of group practice that Mayo Clinic is so successful at. I venture to predict that if the brothers Mayo had tried to organize the clinic and its practice as they did in the 1920s or 30s, I doubt very much that anything comparable to the Mayo Clinic could ever have developed or been achieved. If you look at the numerous examples around the country of a similar attempts, a few managed to survive. The Roos-Toulouse Clinic, many of you know about the case of Washington Group Health, which brought an antitrust suit against the American Medical Association, which it won. Very few occasions have groups of physicians who wish to practice jointly, and particularly in a slightly different arrangement than Mayo's with prepaid care, they had enormous difficulty in getting established because of the concerted opposition of the American Medical Association. This is not the place or the time to explain either why organized medicine took this approach. It was because of certain features of individual practice that no longer are important, in particular the sliding scale, which has disappeared with the emergence of insurance on a wide scale. But whatever the reason, the effects are clear. In my opinion, if the American Medical Association had not exercised the monopoly power which it did over a long period of time, American medicine would have developed very differently than it in fact has. It would have developed, in my opinion, primarily through organizations such as the Mayo Clinic, through joint teams of hospitals and physicians, and I believe that that would have provided more adequate and more inexpensive and higher quality medical care to the American people. To begin with, a greater involvement of government in medicine may seem to serve the interests of at least the purveyors of medical care by providing an additional source of finance. This is a honey that has led persons in industry after industry to support and promote governmental involvement, which has reacted ultimately against them. I have been impressed again and again with how often businessmen, leaders in various areas, who are very farsighted when it comes to their